Hello everyone, my name is Lon Cao and I am a licensed acupuncturist. Today I would like to talk about Chinese medicine and eye health as our eyesight affects our everyday life. In 2016, a group of scientists convened and they published a report which aimed at making eye health a population health imperative. In 2014, there was a public poll of Americans, and it found that people these days are much more concerned about losing their eyesight than they were of losing their hearing, speech, or memory. Today, I'd like to focus on a common eye condition called visual fatigue, which includes symptoms such as blurry vision, eye pain, headaches, dizziness, teary eyes, and nausea in some patients. And Chinese medicine can be very effective in addressing not only visual fatigue but various eye conditions. According to the World Health Organization, their 2003 official list talks about the clinical trials and reviews for acupuncture, and some of the conditions that are effectively treated with acupuncture include Sjogren's syndrome, which dry eyes is one of the key symptomatic manifestations, and also other conditions like central serous retinopathy and color blindness. So in Chinese medicine, we view the eye as representing the entire body, and all the channels are represented in the eyes. But in particular, the liver channel, the heart, the kidneys, and the spleen channels have a close association with the eyes. The liver channel in particular stores the blood, so it provides the purest blood for the eyes, and the kidneys control the fluids and metabolism, and so it provides the moistness that our eyeball needs, and also maintains the shape of the eyeball. And the spleen is where the blood is made and provides nourishment for the eyes as well. And the heart is associated with our vessels, and it's where our spirit resides, so that also has a close connection and with the eyes, and the heart provides nourishment for the eyes. In terms of treatment, the combination of acupuncture and herbs is very effective, and generally the treatment plan would be anywhere from 2 to 3 months. It's recommended that getting acupuncture once or twice a week is much more effective than just getting it periodically once a month. And the herbs, again, the point prescription and the herbs would be dictated by the pattern differentiation of the patient. So a patient, for instance, with a liver qi stagnation pattern and have menstrual issues, this woman would do really well on Sha Yao San. A patient with a liver and kidney deficiency pattern would do well on formula and Qi Chu Di Huang Wan to help improve their vision. And a second part of the treatment plan is the patient self-care, and there are 2 acupuncture points which I find to be very effective. First is UB1, Jingming, which is brighten the eyes, and this is most effectively stimulated with the elbow on the table, index finger and the thumb, and putting pressure here. With the location of UB1 is in the depression slightly above the inner canthus, and so what we want to do is lean the head towards the fingers, allowing pressure to occur there, and we want to hold this position for 2 minutes. So 2 minutes equals 1 cycle, and it's recommended for the patient to do 6 to 9 cycles a day. The second point is GB20, Feng Chi. This is wind gate, and this point is in the depression between the sternocleidoid mastoideus muscle and the trapezius. So it's in the depression, and again we want to apply pressure for 2 minutes, and again 1 cycle is 2 minutes, and it's recommended for the patient to apply pressure 6 to 9 cycles. And there are other resources for the patients, over-the-counter drugs, over-the-counter eye drops in particular, or prescription eye drops is also helpful for dry eyes, which you'll find in visual fatigue quite often. And probably key is to keep up with the regular eye exams with their eye doctors, with optometrists, ophthalmologists is also very important. Community resources for patients with eye disease. The National Eye Institute has a list of various resources for low-income families, for seniors, for students, or the uninsured. So, programs such as the Eye Care America or Sites for Students. And in terms of prognosis, prevention, especially with the patient self-care, is very important for a better prognosis. And early detection of eye disease also helps to prevent its further progression. Thank you very much. I hope you enjoyed this video, and that's all I have for you today.